Last gasp for the Bears. It's Treston Ebner. There's a little structure.
Join the more than 7 million adults, like Michael, who've taken Ozempic.
Attention diabetics and weight loss patients. If you or a loved one used Ozempic and later experienced serious side effects, call right now. You may be entitled to financial compensation.
Saturday. Timeout in the game, and suddenly you're in a clinic. A calm voice promises relief from a disease you didn't even know you had, while tiny text at the bottom warns of liver damage, bleeding, even death. Then the next commercial is a law firm asking if that same drug hurt you and to call now. I keep asking myself, who is this really for?
We have similar concerns about any kind of advertising that's on TV, certainly when we're talking about ED drugs. But we also know there is a lot of trash on TV. And there are ads. I mean, it's even tough when you're sitting watching a ball game with your kids on a weekend. I have to sit there with the clicker as soon as any ad comes on.
Almost every prescription drug commercial ends with the same 3 words, ask your doctor. On the surface, that sounds reassuring, like you're in control and just need to start the conversation. But when you zoom out, the picture is weird. In most countries, prescription drug ads straight to patients are banned. The United States and New Zealand are the big exceptions. In the late 1990s, the FDA relaxed TV rules. Drug companies only had to say the biggest risks out loud, the major statement, and they could push all the fine print to a website or a phone number. As long as the ad adequately provided another way to get the full prescribing information, a website, a toll-free number, or a magazine ad, the company didn't have to squeeze every risk into that 60-second TV spot. On paper, the idea was fair balance, benefits and risks side by side. But when you actually watch the ads, it doesn't always feel balanced.
The question, do TV prescription drug ads inform patients or mainly sell expensive drugs people don't fully understand? If we keep them, what rules would make ads patient first, not company first? Case study I use, Ozempic. The declaration promises life and liberty and says the power of the government comes from the people's consent. In my community, drug ads are everywhere. If they push costly drugs people don't understand, consent isn't informed, and those unalienable rights are weaker.
When people see these ads, they really do ask for the drugs. A review of doctors' surveys found that when patients request advertised drugs, physicians feel pressured to say yes, even when they're not sure it's the best option. This same pressure shows up in my correspondence with Dr. Macart, director of the UT Center for Health Communication at UT Austin, who puts it this way. One of the biggest risks is people can get set on a particular drug as the solution, whether it's the right one or not. He then goes on to say, I think it can be a big challenge for clinicians to navigate patient interests and demands for a particular medication. A recent review of TV drug ads found that almost 2/3 were rated poor scientific quality, with nearly half judged misleading or even potentially harmful. And when researchers looked closely at hundreds of commercials, they saw that only a minority clearly explained how the disease works or who's at risk, while about 94% leaned on feel-good emotional images instead of the kind of facts you need for a careful medical decision. Prescriptions for drugs like Ozempic exploded once TV ads included that this medication can cause weight loss.
What do we know about the long-term effects of it?
So I think that's a concern that we don't have 100 years of data. We have 20 years of data.
Long-term side effects are still being studied for people with diabetes and for people without diabetes. Many serious problems are already arising, and the warnings are still changing. How can a 60-second commercial possibly give patients what they need to decide safely?
They downplayed the potential harm that it would cause, and it's causing these very severe side effects. And so people are now bringing these lawsuits.
And behind all of this, most patients still don't really know what these drugs cost. For a lot of people, the ad ends in confusion at the kitchen table, not in the exam room.
Since my first term in Congress, I have introduced legislation to get full pricing information to patients without them having to ask. I mean, I've actually asked how much it costs with insurance, gasped in dismay, and then had the pharmacist suggest that I walk over and get a little plastic GoodRx card. And I have heard from other constituents who do that.
Dr. Macart told me that a good first step in fixing these ads like Ozempic is actually pretty simple. He says, I would prioritize plain language for all the fair balance. Clearer and simpler communication in those ads would help everyone better understand the ads. And he also says that until the rules catch up and reform does happen, a crucial piece of advice would be don't let a commercial be your only source. Go get information from multiple sources about anything you see an ad for. Read a few news articles, talk to your doctor, etc. So what should we do? The Declaration of Independence says government exists to secure our rights and gets its just powers from our consent. So drug ad rules should move us towards real informed consent, not just more sales. I don't think the choice is either ban the ads or let anything go. We could keep them but change the rules so they actually support informed consent. Keep risks on screen as long as the happy images. Require a simple cost and options box with list price, typical out-of-pocket, and at least one lower cost or generic alternative, and slow down heavy marketing for brand new drugs until we have years of real-world safety data, closer to the decades we have for older meds, not just 20 years or less. And if there's one line to take seriously in any drug commercial, it's ask your doctor. Use the ad as a prompt for questions, but trust your doctor's judgment over a 30-second sales pitch. This film doesn't tell you what pill to take. It just asks whether our ads are serving patients or the people who pay for the airtime.